Medicine waste is a huge problem within the NHS, with an estimated 300 million wasted annually on unused or partially used medicines. In hospitals, this waste is added to when patients do not take their medicines home or when medicines are not transferred with them as they change wards. Our project aimed at changing that by moving patients' medication with them and returning unused medication in a timely manner so it can be reused instead of disposed of.
So before our project begins, the medication is dispensed here in our pharmacy. A clinical assessment of every prescription is undertaken by a pharmacist to determine the suitability of the medication, the appropriateness of the quantity and the dose frequency for the patient. When the prescription is selected by the dispenser, it is then taken into our labelling workstations. This is where they will work through the prescription, booking out the medications to the right ward and patient and labelling the medicines as per the prescriptions. As the dispensers and SATOs label the medication, the robot selects the medication from the shelves inside and sends them down the chute to the relevant workstation. Once the prescription has been labelled, it then requires dispensing. The dispenser and SATOs then work through the prescription, making sure the medication and label match what the prescription has asked for. It then requires a last check of accuracy. Once the ACPT has completed their checks, it is bagged and put into the relevant trays for the wards. The porters then take the medication up to the wards at set times throughout the day. Any urgent medications can be collected from pharmacy by the wards.
Before the project, there was no clear designation of responsibility across stores, ward teams and dispensaries, resulting in a large volume of medication waiting in the returns area. For this project, colleagues are allocated wards to check at least 2 or 3 times a week for medicines that have been left behind or are no longer needed. Before we return the medicines we've collected into pharmacy stock, we perform rigid checks to ensure that it has originated from HHFT and is stored correctly and is still in its original container with at least 3 months to go before its expiry.
After 1 month, nearly £7,000 of medicines were returned for redispensing, saving over 2,000 kilograms of CO2. If we were to roll this out across 45 wards at the Trust and we only make half the level of savings, we could still achieve the annual efficiency of £230,000 and 7.6 tonnes of CO2. Not only does this project have those amazing benefits, but it's meant our staff have greater responsibility, we've achieved better relationships with ward teams and improved communication across the board. We did all of this thanks to Hampshire Hospitals participating with the Centre for Sustainable Healthcare in the Green Team competition to explore the impact that pharmacy can have on supporting the green agenda.